but I've had quite a few people as of late that are coming in for liquid lift consultations, and I kind of give them the mirror and I'm saying, okay, what it would be your ideal outcome? This, they're wanting this, okay. Everybody does it. They just want that they want the lift. Physically, fillers cannot physically lift the tissue. The rheology of the product, the way it's made, what a filler actually does, it physically cannot lift tissue, okay? If you are doing this and you've got more than a 1 centimeter lift when you're at the end here, you need surgical intervention, okay? You have to be realistic as to what fillers is going to do for you. I had a little giggle there because everybody does it, including myself. You know, we all do it, but we've got to be realistic as to what is achievable with non-surgical treatments. So filler is fantastic if it is the correct product in the correct plane with the correct quantities. It can look unbelievable. Filler is a synthetic hyaluronic acid gel, and it will effectively draw water to that area. It'll either volumize, it will give projection, or it will hydrate. It will fill a line and a wrinkle, and it can also give you back volume loss. There's totally we use Kaisense, which is a good range of different molecular weights of filler, depending on what you want it to do. Ultimately, we're getting this nasolabial fold, which is what most people are concerned with, because of the volume loss in the cheek. Okay, a lot of people are reluctant, they're nervous, they're worried about having a mid-face volume replacement. Basically what's happened is we get bone resorption across this midsection here. The bone rotates back, it gets shorter, and it gets loses its density. In effect, that causes the fat pads to separate, deplete, and they start to gravitate down. The nasolabial fat pad falls forward and sits heavy against this nasolabial fold. So what you visually see in the mirror is these creases here. This is the effect, guys. This is the cause. You cannot keep treating the effect without addressing the cause, because what you're going to do is distort the face. You need to be balanced up in this area here to give the illusion of a lifted look. You cannot keep treating the effect without addressing the cause, otherwise you're going to look like this, okay? Saying that, you don't want too much cheek filler laterally, because you're going to look like Maleficent. So it's all about harmonizing and working with the fat pads and just restoring the face. There's two ways to treat with fillers. You can either enhance or you can restore. So if it's done right, if your filler in your liquid lift is done right, it will give the illusion, underline, of a lifted look, but it won't physically lift the tissue. If you are lifting like this in the mirror and there is more than a 1 centimeter ruching at the back, it is surgical intervention only. You have to be really realistic. Fillers are fantastic, but they are not going to give you a facelift. If you are lifting but it's not over 1 centimeter, then maybe the PDO threads are for you. They are absolutely unbelievable, but again, they are not going to replace surgery. You have to be the right candidate to get the best result. You can be too lax, you can have too much volume loss, and you can have too much hollowing, where threads won't actually be suitable for you. So they are definitely consultation dependent.